All right. Well, this is the sixth QHSC conference in response to the COVID-19 pandemic. It is titled A Career in Healthcare in Light of COVID-19. And I would like to introduce to you Dr. Harriet Gabone Mwalupindi, the president and founder of Quality Healthcare Solutions and Consulting.
First of all, I want to say thank you for everybody who give us some time to come and hang out with us this morning, and thank you for all the panelists and people who are going to be discussing all the healthcare issue related to students wanting to join this healthcare profession. And so we're going to try to find out some challenges and learn from each other. We have people from all over the world, so we're going to I will encourage you to still put your name there and where you're from, so at least we can acknowledge you coming and joining us this morning. So it is great, and thank you for being here. So we always have been doing these conferences now. This is the sixth one. We try to encourage inviting people from all over the world to come and share the best practice. So, and this, as Mr. Frank said, a career in healthcare in light of COVID-19. And so I also want to thank you, the board members for the QHS, the co-hosts who are going to help us run the meeting today, and all the QHSC members. So thank you very much for everything you guys do. So if anybody is interested in joining our organization, it's called Dr. Gabone QHSC Incorporated. So you can go to the website. The link is on the bottom there. Join and be a member, and come and let's try and educate and train healthcare workers throughout the globe. So we did, as an organization, we did have planned a medical trip to go to Tanzania this September. However, with COVID, we had to postpone it. So the trip is going to be next year. However, we're still accepting donation and all the supplies we can collect to go and help all those vulnerable population here there in Tanzania. So thank you for people who have been continuing supporting us, and will continue supporting us for days to come. So thank you again. The reason we are here today is because we always want to cover quality healthcare solutions and consulting throughout the globe, and we try to build a strong global healthcare workforce by sharing best practice. And then so we have, as I said, we have so many people from around the globe, and so all their suggestions, opinions that they're going to share today, it's their own individual perspective, so we don't have to hold the places that they work from accountable, but this is just an individual, so we can share and learn from them. The reason we have the conference today is just because of the increased demand of healthcare workers during the COVID pandemic. So we know there's a lot of concern, fears, and challenges, and of course, as healthcare workers. So now we are thinking, in order to grow our healthcare profession, we need to get all the students who are interested or inspired to come and join us. So the goal for this meeting today is to try and inspire our new, our future healthcare workforce to be able to have that mental health awareness, or having these coping skills, so they'll be able to know their limit and be able to seek help if they need more. Because we've seen how much healthcare workers have been affected with this COVID. The demand has been so high to a point that people are passing their own limit and start getting concerned or sick because of this stress. So if we can try and help the future healthcare workers, that would be great, and that will be our contribution to prepare for that. So before we can start, I would like to do the polling to make sure we know who is here. And so I am gonna start. There are 4 questions. There are 4 questions, so if you can answer them, and then on the bottom, then you can just click submit. So like the first question is asking, are you currently a healthcare professional or a student of healthcare profession? So you can answer that. And then which area of the healthcare? And then have your perspective changed because of the COVID? Because there's a lot of trauma, stress about this. And then the last question is, have you considered leaving a profession? Which is understandable. I mean, people have seen things that you should never see before, but we know as a healthcare workers, we always go in these situations knowing things could be like that, but this was in proportion So at least we have like 94% here are healthcare, which is great, and that's the reason is. And we appreciate people who are not healthcare worker, but probably still work with the healthcare individuals. So we appreciate that. And nursing, of course, is majority of them, like 63%. The doctors, physician or nurse practitioners, 13%. That would be great. And clinical officers, this is specifically for Tanzania, it's 6%. Pharmacy, 6%. That's okay. And 63%, yeah, we do expect that because of the stress and trauma that, and are you going to be changing up? So 13% they say that's fine, still the same as 25. But those are experienced people, which is great. And then have you considered, no, so wow, 94% still want to stay in healthcare, that is great. And so whoever wanted to share this point, your concern or points of discussion, so please put it in the chat room so we can be able to discuss that. So thank you very much for your response to that. So if you can introduce Dr. Borez so he can come and just say hi first, and then we'll give him some time to speak in a few minutes, but just in the beginning, just to say hi.
Okay. So Dr. Sambore is a licensed professional counselor, supervisor, and he has a PhD in counseling, and he specializes in child, adolescent, and marriage and family counseling. And he is also a professor of counseling, as well as he practices in a private practice. And his goal for today is to address anxiety, fear, and the impact to mindset when dealing with traumatic events.
Dr. Bore, if you can say hi, and then I'll give you some time in a few minutes to speak.
Well, thank you. Well, good morning, everyone. Hopefully it's good morning. Maybe this part of the world could be a good afternoon in Tanzania or the rest of the world as well. Good morning, and thanks for having me again. This is my second time coming around, and it's my pleasure to join you as early as it is very early in Texas. But good to see some faces that we did see last time. And I think we could not have been in a better place than where we are right now. So thanks for having me.
Thank you very much, Dr. Bore. If you can introduce the Dr. Mosomi, although she's not here, but she did send her message. So if you can introduce Dr. Mosomi, please.
Absolutely. Dr. Maria Mosomi is a board-certified family psychiatric mental health nurse practitioner in Arlington, Texas, and her content today discusses resources for effective coping strategies.
Yes. Okay.
Good morning, everyone. My name is Dr. Maria Mosomi, and I want to apologize that I'm not able to be with y'all this morning, but I wanted to leave you guys with something that may inspire you as healthcare providers while you embark in your education in the healthcare field. The healthcare field is a field of servitude in caring for others. But one thing that is very important, in order for one to take care of others, one must be able to take care of themselves. So as you are challenged with all the things that are happening in our society, healthcare-wise and economically, I want you to really look inside of yourself and see what brought you into this field and what did you want to contribute to society, and what is your purpose in life in terms of being there for people, and in terms of what did you want to give as a provider to the world, being a medical provider, being a nurse or a doctor or a health tech. It can be scary knowing that there's so much going on and there's so much uncertainty. But just as if this pandemic was not in place, there's always uncertainty with careers and choices that we make in our lives. But the most important thing is what is your purpose and what you want to give to the world as a provider, as a nurse, as a doctor, or as a tech. I want to leave you with this brief quote. It says, "Believe in yourself and all that you are. Know that there is something inside of you that is greater than any obstacle." Believe in yourself. That's number one. And know what is inside of you. And always remember that you have something greater inside of you than any obstacle that is outside of you. I would like for you to challenge yourself, to search within yourself and see what you want to do in your future, and how you can impact the world. The special thing about being a provider is that you may not think that you're impacting that world, but that one patient that you take care of can be a ripple effect of people and generations that you're going to take care of. Often enough, when I take care of my patients and I see some of the mental health issues that they're going through, or the despair that they go through, I know that if I can make a change, if I can help this person, they will have an opportunity to be a better person in their homes, in their families, in the community, in the place of work, in the place of church, and anywhere else where they go. Despite their race, color, gender preferences. So you are making a difference as a healthcare provider, when one person at a time, one patient at a time. So I applaud you for taking on the challenge of being a healthcare provider in at this time in the life that we live in at this moment, because we need you more than we need you now more than any other time. And if no one can do the work, then who will be there to do the work? But search within yourself first. Take care of yourself first. See what drove you into this field and what you can offer the world. And congratulations, and I hope that this can inspire you and motivate you to continue in your healthcare journey.
Thank you very much, Dr. Mosomi, and thank you for sending that video, because we really needed to hear that. Whether you're a student or you're a healthcare worker already, you do need some reminder and the reason why we chose this profession. So I'm going to start letting the students start speaking, and then I'm going to ask Dr. Sambore to try and provide some guidance, answering questions, and of our new future healthcare workers. Okay, to start with, Miss Sandube Mwakalinga. So she is student of pharmacy, and we know, included in healthcare worker, we do need our pharmacy, and we do need now, because especially for all these questions about medication that during the COVID-19, so everybody was uneasy because some of the medication, they say some of the nurses have never taken care of, or the doctor have never prescribed them. So we always need our pharmacists to our healthcare practice. So I'm going to invite Ms. Sandube Mwakalinga and just give us a little brief. How is the COVID-19 affected you, schooling or studies, practice, things that we have been used to do before, now you're doing different because of COVID-19?
Okay, well, good morning, everybody. Good afternoon. Like she said, my name is Sandube Mwakalinga. I'm in my 4th year of pharmacy school, so I graduate next year. The way that COVID-19 really affected me, so for my school, I was actually on spring break, which was a vacation period for a week. And then all of a sudden it went from everybody's enjoying their week off to you guys have to stay home. Then it went to online Zoom classes. Specifically for pharmacy, I wasn't as affected with changing to Zoom courses because some classes required Zoom meetings for certain things. However, people that have to take labs, or I believe physical therapy or OT, they're more hands-on with their patients. They were greatly affected because they couldn't go on clinical rotations. So that was just overall just adjusting for the last 2 or 3 months, just trying to figure out Zoom, trying to hilariously see teachers adjust to Zoom for the first time. But overall, we ended the semester on a good note. However, for starting 4th year, you pretty much start at the end of May with your clinical rotations. Now for clinical rotations, I'm on my first block, so I was lucky enough to find a hospital that was open at the time that was taking students. It really depended on the preceptor or the mentor's availability, because we all know with COVID-19, we have populations that could be elderly, immunocompromised, and sometimes those sites will not allow students to come in. So I do have friends currently that are doing mainly online rotations rather than going into the hospital. Also, I'm sure the New York State nurses can talk about how different it is from downstate New York, from upper New York. Right now I'm in Buffalo for one of my rotations, so they were able to prepare a little bit better than New York City was, just because we saw how New York City is greatly affected. The population size is definitely a lot bigger compared to Buffalo, so we were able to prepare a lot better. And so far I've had a great rotation. Definitely have seen some COVID cases overall, but like I said, we were able to prepare compared to New York City. So it's definitely been a new experience for me, not what I expected for this rotation, but I'm happy I'm able to see pharmacy on hand, because we're not considered essential workers in the beginning when this conversation was happening. So now that, people are starting to appreciate that pharmacies are open, some pharmacists are staying later hours, some pharmacy interns, and then also just being able to see my preceptors and mentors be very vocal when it comes to what drugs can be used in some patients, because we all know that the drugs have fluctuated so much after the last few months. And being the drug experts that we are, people are starting to utilize us like, okay, is this the right thing? Is this something that I can use in this patient? Because there's so many contraindications and so many clinical pearls that nurses and doctors might not know, but that's our area of expertise. So it's been really great to see pharmacy be more utilized and more respected as one of the healthcare professionals.
Thank you very much. So I'm going to ask you a follow-up question quickly before I let Dr. Sambore give some guidance with mental preparedness. So what are the things that work for you? Because I know I'm glad that you have a better experience compared to other probably pharmacy students in a different area. As you mentioned, New York City, because everything was happening too fast and everybody did not know how to react quickly to address those things. But for your case, what are the things that prepare you or help you through this time of changes and keep up with the school?
Yes. So when first adjusting to school, obviously going from an in-class format to online is definitely more hectic. I definitely invested more in focusing on my planner. At first I was like, COVID-19's here, just throw out the planner because everything's pretty much out the window at that point. But making sure I'm organized with my planner and checking in with my calendar. Also, what's been great about COVID, about the experience, was just checking in on friends and just checking in and taking breaks overall. Especially with pharmacy, this is, a lot of us are type A personalities, and it's the first time that it's like we're inside and we're with ourselves, and it's time to self-reflect and self-care. So it's been a time for me to really check in with friends and have those deep conversations like the one that we're having now about what our role could be in the future. So those have been my main outlets, because you can't go outside at the moment. So, or before, now that I know that certain places are opening to phase 2 and phase 3, but it's been more of checking in with friends just to make sure that we're all mentally good.
Okay, thank you very much. Dr. Sambore, I'm gonna give you an opportunity to, if there's anything that Ms. Sandube Mokalinga and the rest of upcoming future healthcare workers to keep in mind when they're preparing for this situation. If there's anything that you can add there or advise, that would be great.
Well, thank you. I think that was great, the way said it well, and I appreciate your coming across that way. And what I wanted to say for students who are in your situation or similar situations that you are right now is, from a mental health perspective, all of us need to be reminded that there's only one constant in this life, and that is change. And we may not have room to decide how change comes our way. However, at every instance and at the very point of our lives, we have the power to actually respond to that change. We have that power. And given that change, therefore, is a constant that we cannot do away with and we cannot wish it away, we have to be able to learn the skill of when change does come our way, how do we navigate through change? And that is the skill that you actually were able to use at this time and what we need to use as a people. We've seen this big change right now. We might still see bigger other changes come and maybe even change for the better. And still, that will require our navigation. So in a mental health perspective is to always remember that anxiety in a simplified way is always when our outcomes or comes our way, when our outcomes are not what we expected. And right away, that gap of this is not what I prepared for. I was looking forward to finishing my spring break after kicking back and just going to have the final stretch of this business of school, and then go there me and be a pharmacist and like anybody else who's been there. Those plans were right, were in the pipeline. But when that curveball is thrown our way, it's incumbent upon us to say, what is it that's required of me right now? And you said it well. The first requirement for all of us is to be able to go inside of us and ask, what can I do differently? Because the time is different. Thank you.
Thank you very much, Dr. Sambore. So to connect with that, Professor Tate, do you have anything to add? Thinking of students who are learning pharmacology as a professor at South University, is there anything else that you can advise people who are preparing for that?
I do have some input on that. What I want to say is that I think, I know the preparation, just to piggyback off of what the lovely gentleman just said, I think that what's important to remember is that we all went virtually. So that change right there was instant. And it caused a panic, not only with the instructors, but also with the students. We had to try to do everything we have done initially in a classroom on a computer screen, and then bring all the students, engage them, give them new rules and regulations. And not only was it trying and a tireless effort on all of our part, it was very exhausting, confusing, and I don't know what word I want to use, but it was a daunting situation for the students. They needed a lot of encouragement, a lot of push, a lot of, you can do this, you can do this, the encouragement and love. We had to become very non-judgmental in what the students were presenting to us as we presented materials that we weren't used to presenting. So it was like on both sides, it was just a hot mess. Katie Kiger, who's also in the meeting, has worked tirelessly along with yourself, Dr. Gabone, to try to get things organized. And if I could say one word that would help anyone that is going virtual in their schools, it's organization. You have to be organized and you have to be prepared. But how are you prepared when you have a COVID-19 pandemic going on and you never use these materials? You have to take it step by step. And you have to start, what are you going to use? You're hoping and praying that it is going to be effective for everybody and user friendly, and that's not going to happen. You have instructors, students, from your program directors that have never used any kind of product, any kind of virtual product. They've never used it at all. So you have to be organized and very non-judgmental and trying to get everybody on board to use these products.
I know, thank you. So it's been a challenge for everybody. As you mentioned, even faculties, either you were doing it in the hospital or in school, has been challenging for everybody. So I am gonna invite Dr. Shrim Patel. She's a specialist registrant from UK. If you can give us a little background, what does that mean, specialist registrant, and what you do, and the effect of COVID-19 on your daily routine, then UK.
In acute medicine department in Queen's Hospital, Romford in UK with Dr. Malawa. When COVID-19 started, initially I was on my holiday, so I had to cut short and take back a flight to come back to UK. My family was in denial that they were like, because I was with my family, they didn't want me to go back. They were scared for me. How are we gonna travel? And it was a lot of travel. And as we know, in the beginning, it was all from the travelers who brought in COVID. They were scared for me, but when it hit, it was like I was feeling somewhere in my guts that if I don't work now, when am I going to work? Because in the end, I work as a physician and I'm a doctor. So now the society needs me more than normally that they would need me. And I was like, if I don't go back and work now, I'll be living with guilt all my life. So I just had to choose against my family to come back to work. And then when we started, because no one was prepared, we never had a handbook how to work in a pandemic, never had any guidelines how a pandemic is going to affect the trust as a hospital or as a doctor or the nurses in the hospital, how they're going to work all together. We didn't know anything. So when we started, we had to change our routine, our schedule, where we normally used to get like a 6 to 8 weeks notice how our schedule is going to be, and we planned ahead for our vacations, our family trips and reunions, everything in 3 to 6 months in advance. We were told a day before that, okay, from tomorrow you're going to work a different shift in a different department, a different ward. Nobody were used to working in that situation, and it was very stressful for us, because I remember when I came back on my first shift, it was my night shift, and in the morning we were told, okay, this is going to be a different rota for all of you juniors. And then I had to sit down after my night shift for next straight 12 hours to design a new rota for all the junior doctors to work upon, which we then got approved from our medical director, and then we started working. But everyone coped very well because everyone was willing to work. So we worked as a group, and I think that's very important when you work as a team, because we had a team of neurologists, ophthalmologists, trauma and orthopedics. These doctors have never worked in a medical ward for 10 years or 20 years, because I still remember we had neurologists and she was like sitting right next to me and she was like, I've never worked in a medical ward for 20 years. Like, you have to tell me how to do. And they were like asking questions like what AKI means, like acute kidney injury, because they don't come across all those things, treating acute problems for a patient. And then we had a very difficult time because a lot of people, almost we had 13 wards full of the patients with COVID in the beginning, and everyone, almost everybody was on oxygen. There was a point where we were running out of the facility, so we had to actually think and prioritize the situations that, okay, this patient needs the ventilator more than the other one, and he might benefit compared to the other patient we have, whereas 2 patients are needing the ventilator and we have only 1 ventilator. It was an ethical decision and a very difficult decision being a doctor to make. I still remember few of those faces I can never forget in my life when I saw those patients, because they had daughters like 15-year-old, 16-year-old. And then you're like, do you want to do a face chat or a Zoom call, a WhatsApp call to your daughter, to your family, because families were not allowed to come into the hospital to visit the patients, and it was very difficult. But then I think you get used to working in that environment, and we all went through that, and we came back as a team because we had other colleagues who went through the similar experiences. And when working in that way, you come closer together, because I feel more closer to my colleagues and my nurses compared to I used to before. I know my HCAs, the sweepers, the cleaners in my department very well, what their families do and where they are, because most of them were self-isolating, working separately, living away from their families because they had kids at home, they had elderly parents at home, they couldn't visit their families. And I think in a way, it has changed my perspective working as a doctor during COVID. I think humanity is more important than our profession or anything.
No, thank you very much. You mentioned a great point that I was looking for, and I appreciate it. Working together, you get to know your nurses, get your housekeeper, administrative, because you will all work together. So that is a huge, huge part, and I wish to everybody who is here to take that with you, that in this situation, stressful situation, which is changing all the time. So working together and support each other is the only way you can survive and pass through that part. So I'm going to bring back again Dr. Sambore. You had Dr. Shrim Patel, and they did a great job of adjusting or responding to those challenges. Any tips or suggestion you have for them, for the doctors, nurses, pharmacists, whoever work together, if you can add?
Very true, yeah, and thank you so much for that's well spoken and well put. You found a very interesting thing in this pandemic in terms of what really matters to us in life. I think for a long time as a people, things had been so normal, although there's really nothing called normal. We always negotiate new normals in life. And this was just pronounced. That is why the new normal or the normal became a little bit clearer. So you brought a very important point that I wanted to push across to everybody else, especially our students who are coming in. And you talked about the moral urge and the moral obligation that pulled you to go back, even while your family was wondering and fearing for you not to go back. But the moral obligation in you said, in this time, I need to be there. This is a calling that I have within me, which brings a very important point that for all of us who are here, at this time, as we become nurses, doctors, or as we continue being nurses, we have to be able to go back and answer the question, why am I in this? What is my why? The moment my why is clear in life, my how becomes easier to find. And I want to be able, just very quickly, because I know we'll have so many other questions coming in. I want this line to stay in your mind, that I am a nurse, I am a doctor, I am wherever I am, because, make sure your because is very clear why you are in this. But do not stop at the because part of the statement. I want you to say, I am a nurse, I am a tech, I am a doctor, because, and it means this to me. The moment the meaning part of that statement is qualified and arrived at, you are in a good place. Because when such times as this is when our existential meaning has to come out of us. And when that existential meaning is absent, then our will, our energy, and our purpose of doing it is absent. And therefore, we have to be able to begin at the very end of it and add the statement, I am in this because. And that because is as individual and unique and personal as it can be. But it's what will drive you to get up in the morning. It's what will drive you to say, if there is another pandemic or even a breakout of anything in a remote part of the world, this is when you say from within you, here I am, I need to go. Because I need to be there. Why? Because I am a nurse, I am a doctor, I am wherever I am because of this, and it means this to me. And meanings are so individual. So thank you for putting that across.
Thank you, Dr. Sambore. As we continue discussing changing our best practice throughout the globe, and I am going to invite Ms. Consolata Peter Mosha. Are you there? Ms. Consolata?
Yes, I am.
Yes, she's clinical officer in Tanzania. Welcome. Just tell us how the COVID has changed your routine schooling or routine practice.
In this difficult time, our teachers and our doctors here at the universities have tried their level best to protect us in different ways. For example, during class hours, instead of going all of us at once, we usually go in groups. We are divided into minimum number so that we can give that distance of 1 meter to each other. We also sanitize, we also wash our hands as much as possible, and we wear masks, and we take all necessary precautions. It is difficult, but we just have to cope with the situation and keep on studying and fulfilling our dreams.
Okay, so I'm gonna add more. Why did you choose to be a clinical officer? And does that perception change because of a COVID or disease or your farm, your motivations, or what exactly are you gonna do different now since you experienced the presence of COVID?
To be honest,
yeah,
the passion of me becoming a doctor has never changed regardless of this COVID-19 pandemic.
Cool.
But at some point, it had scared me. It has made me scared because I can imagine in that difficult time, some of the doctors were dying, the nurses, some of the pharmacies, and we sacrifice a lot. It has made me scared, but it has given me a lesson that being a doctor is not only about being intelligent, it's much of a call and a passion, something which is inside me and it can never change because it's what I love. I like saving lives.
That is great, and thank you for sharing that one. Definitely, we are all, it is a core, like being in the healthcare profession, it is a core. So I do appreciate you letting us know you still have that fire underneath you and you still want to do these things. And the reason we choose to be in healthcare is because we want to help others or serve others to help on their time of the need. Yeah. So wanting to do, regardless of the pandemic there, it is commendable. And if Dr. Bore can add anything that you can add to Ms. Consolata there.
Well, sure. And Ms. Consolata, you know, I'm glad you came across from Tanzania on that. I think it's important for us to be able to appreciate that we work at very different environments and contexts that are very different, which have different challenges, therefore. And you brought up a very important thing, that you've had to do what you had to do, which is one of the things that we have to learn to focus on at this time. And the question you want to ask and answer to Ms. Consolata's point was, people are dying, doctors died, nurses died, and that will come. Sacrifices and prices will be paid along the way. But then I think the punchline from what I heard from her, which I want to sell to us, is we have to be able to ask the question, what are we in control of? And can we choose to the responsibility over what we are in control of over fear? Because whenever we have fear being the dominant feeling we're experiencing, then that incapacitates us. It impedes our reactions. It impedes even our thinking. And if there is a time that we need all our capacities, especially our mental capacities, this is a time that we are able to do that. One last thing before we go to somebody else. You alluded to one of the points that I'm sure we're going to make, and we can make it now, that in these times, it's important that our self-talk be very positive, because what we tell ourselves is really most important, more important than what others will tell us. We can come to these forums, but then the loudest voice for anyone of us right now and always is what comes from our internal conversation, is what we are telling ourselves. And I don't remember who said this, but I'll throw it there anyway, that someone said, what a gun cannot kill, what an iron bar cannot bend, words can change. And let me put that into your own mind, that what a pandemic cannot kill, what the scary and the fear of the world that has come our way cannot kill, our internal conversation, if it be positive, can change and give us the meaning. So that positive self-talk, what we tell ourselves, is very important. And this is a point to answer also, that it's not what other people, it's not the name that other people call me that matters to me in this time or ever in life. Rather, the name that I answer to. And in this time, the name I want to answer to in my mind is that I am a servant of humanity. I've been called to a very important profession. And this time, I will stand up to be able to help those I can help. There will be prices and costs to be paid and sacrifices, but yes, I want my internal conversation to be very solid in that way. So thank you for that coming from across the world.
Yeah, thank you, Dr. Samure. I do agree with Ms. Consolata. Yeah, we do serve a higher power, and when you are making this decision to go to healthcare, it has to be beyond just a regular job. It has to be beyond what you need to do for somebody else. And I do appreciate Dr. Samure saying you have to be, give yourself positive talk, like, yes, you can do this. Oh, yes, I can do this. Don't wait for somebody else to reaffirm your conviction. Don't let somebody else change your perception of something and then follow it along. No, but you have to tell yourself positive things to be able to sustain your willing to work in the healthcare. So that was great. Thank you very much. So let's turn around to go back to either Miss, whoever is closest to the camera, then Miss Catherine or Manari, and tell us how is being a nursing student, what is your perspective of change during this COVID-19, and what are the lessons learned that we can learn from your experience and be able to adjust to this situation?
Well, so far it's been interesting trying to get over the technological aspect of learning. I'm not tech savvy, so that's been very interesting and difficult to understand. Concepts of nursing in person is difficult, and then trying to switch it all online. And there's that fear of when you are the nurse being incompetent because I wasn't able to get those skills done. And there's already a hashtag class of COVID. So we're going to be the COVID nurses, and you know, we don't know all the things because we didn't get the experience. So it's kind of, it's nerve-wracking going into a new hospital setting as it is, to not have all the same experience, kind of just really, Zach and me had to rely on each other a lot harder and make our own sort of team from home, and it's been very interesting.
Okay, thank you. Before I respond to your comments, and I appreciate for sharing it, I'm gonna let Ms. Manari, are you there?
I'm right here.
Yes, go for it.
So to add to that, so I feel like everybody learns things differently, and I am 100% a hands-on learner. So not being able to go to the hospital and be in a clinical setting, and you know, our lovely professors explaining how to do a procedure, or you know, how to do things as much as they can. I know they tried their best, but it still was really hard for me to grasp it. And I had to watch a lot of YouTube videos, and I had to have a lot of FaceTime calls with my classmates to just try to like grasp concepts. So it was pretty difficult.
I appreciate both of your feedbacks, but yes, it has been challenging, as I said, for everybody else, including nurses and also the instructors, our professors, and the students. So we are learning together, and that's how we do need to exchange these ideas and learn from each other and be able to know if the UK has done this, or if this was done in Tanzania, maybe could have helped us and make it better. Because we do, I do agree with you, Ms. Catherine, that the nursing part of it is clinical part. So you always want to do hands-on before you go and touch that patient. Yes, we do have simulation, that's great, but you do want to touch that patient before you go to, being on your own and work. And yes, a lot of training, you're going to get it, but yes. So that fear of unknown is always there. But take initiative to go, and as soon as you get to the new place, you tell them how much you know and how much you don't know. And they will walk through the training or orientation and be able to get that, that training you need to be able to take care of the patient. So I'm gonna invite Professor Katie Kaiga, to be able to give just a little perspective of for a nursing student who is worried, or what Ms. Catherine or Ms. Onari have just summarized. If you can just give them ideas of what to expect and just to lay their anxiety less so they'll be productive healthcare workers.
Well, thank you. Thank you for allowing me to speak. I think part of what we have to know is, yes, you're going to be the COVID group. Yeah. But you know what? The hospitals, anywhere you're going to work is going to know that. And it's understanding you and being able to say, I don't know this, or I need help. And asking for help is hard. It's not an easy thing for any of us to do, but it is to say, let me help you. I'll help you. You help me through this. It's going through that chain of command of really talking with your charge nurses, talking with your seasoned nurses, because mostly the seasoned nurses want to help bring you along. And I think that helps. And it's being confident to say, it's okay that I don't know something. It really is. And having believing in yourself that you are able to do this, because you can. And I think having that in your heart and your soul, I've persevered through all of this. I can be that best nurse that I can be. And I think, as somebody said before about change, I had a CEO years ago who said, change is constant and good. And that was driven into us. And I think no matter what, COVID, everything, things have changed dramatically in healthcare through many of our times. And we have to roll with it and have confidence in it and not be afraid to learn. And again, you've all learned in different ways and in different venues, so to speak. And knowing that you can still do that and have that drive in yourself and that positivity that you can and you will be able to do this is what I would say to you all.
Thank you very much, Professor Kaiga, for just informing that there is light at the end of the tunnel. They will be able to function as nurses and professionals. So I appreciate that, your insight.
I'm here.
Okay. So since you're a supervisor, head nurse, judge, and all the title we can give you, in the unit that you did work on COVID, just give them the new perspective of the new nurses who are thinking, for example, they come to work and their unit is going to have COVID patients, things that are changing very quickly. What are your advice that when they get there, how can they find those things out there?
Okay, thank you so much for giving me an opportunity. So during the COVID patient, we really didn't allow the clinical students to come around because we just want to make sure we protect them. However, the people we have a few nurses who were on orientation and we allow them because they are hired. So they help in other few things, not per se to go in the patient because we limit down the nurses to go inside the patient's room. So they didn't really have that touch or to do full assessment because we didn't want them to be, again, to get infected. However, all other things were remaining the same, meaning that we just go like theory, like, this patient has A, B, C, we give this medication because of A, B, C, D, but they really didn't go to the patient. So even the orientation process was really delayed. So for example, if they were supposed to get the orientation for 2 months, then they didn't get 2 months. They didn't go 2 months, so we extended the time. And then when we extend the orientation, meaning that we pay more money because they were supposed to be like productive, but they're not working themselves because they're still on orientation. So things change, but we learn from it and we try to see how we're going to do. But we have simulation labs too, and they use more simulation labs now than going to the patient's room. And that was my observation.
Okay. Thank you very much. So they are going to get specific training and as we said, as orientees, then yes, they will get something like itemized things to do in order to be able to be safe in those environments. And I appreciate that you mentioned that if they get there, those just the nursing students learning in those units, they did stop allowing nursing students there to protect the nursing students. Because sometimes it's hard. As a nursing student, you may see it, okay, they don't want us to go to the hospital. But also as a hospital, you have to protect the new future workforce. So they're gonna limit the number of people because you don't want them to be exposed. So there is always a tag of discussion that, okay, is it okay, is it fair, is it not? But I appreciate you mentioning that, but at least now the nursing student will know that we don't want to just throw them in there to go and get the experience, but then we don't want to risk their life either. So that was great, and thank you for mentioning that part.
Thank you.
So I'm going to let another nurse, Miss Kisha. There is a message from Sophia. I got the question or a comment in the chat, and she is from Dar es Salaam, Tanzania. If you can read that message, that would be great.
All right, so I would like to share this. As a nursing student in mental health, I have experienced a raised level of anxiety among health professionals, considering the WhatsApp videos were all over from UK, US, Italy, and elsewhere, where nurses sent video crying while explaining what they are going through. So it was a real bouncing in the hearts of nursing. Again, the fear of lockdown raised the anxiety level because of thinking on how to earn for their families. It was not easy for the nurses to accept caring for COVID-19 patients. The fear of nursing, of contracting the novel virus was so huge. That's what her message is.
Okay, thank you. Thank you, Ms. Sophia, for the message. And I appreciate you finding alternatives so we can get your experience. That is a very, very real fear that a lot of nurses, not only nurses or doctors or pharmacists or anybody else, anybody who is working on that environment, that is a true fear. As you see these videos, people are dying in front of you, people are complaining, lack of PPE. I mean, that is another story. So if you know all those things that I see as a healthcare worker, you have to go in those situations. That fear is real. And Dr. Sambore, are you there?
Yes, I'm here.
Yeah, if you can provide just some guidance for somebody who has that fear, some guidance that what are the things that they should be able to do before going there and when they get there and after they come out from there. So what are the things that they need to do?
Well, thank you again. And every minute we have someone that is reaching us out from, especially from Tanzania and other parts of the world that are, maybe have more challenges than we do. Although all of us do, I'm really very appreciative to hear that, you know, what they can do. But yes, number one, being in a situation where you are as a student nurse or a nurse right now, and when receiving all the messages that we've received all the time of, you know, people dying or being there when they're dying or losing people or patients or families and all that. Over time, we are, as a nurse, one thing that you have gone through and will go through is a lot of compassion fatigue that will actually put us down. Number two is that typically whenever losses come, there's a time that we grieve and it's over. But when it's extended, we've ran into traumatic grief because it's not ending and we don't even know when it's ending. And our minds are not designed to be in a state of panic or a state of stress for a long time. That is why our bodies are made to be able to handle something and go back to the normal. In my field, we call it we call it that equilibrium, where we're looking for. Your body is made to actually have an homeostasis of equilibrium. So you have a stress and then you go back to that. So this biggest part has been the traumatic grief that is extended and continued. And because of that, burnout becomes a big deal. And that burnout is what I want to address before I actually go to the three things that I want to be able to help the person that is asked that question. That for all of us, we have to understand that burnout is an evolving thing that will come our way. And I don't want this to sound like it's a bit cold, but let me put it across there. There is no magic pill. And this is where most of the people run in trouble. because we're looking for what is it that will help me bounce back. Be reminded that while we've hit the storm or the turbulence in this life as we have in this past 1 year as the people of the world, hitherto, we had been trained to be what I call instantaneous people, where we needed instant results. We've been trained to be microwave products of microwave thinking, where we cannot wait for things. We want tea to be made, we have a microwave. We came from 2G to 3G to 4G to 5G. And unbeknown to our minds, we have been conditioned for instant gratification that comes our way. What do I get right now? Those of you who are in the field, I'm sure somebody was in the pharmaceutical field, how much we crave for and desire for instant fixes. Give me something that will help me be up and running tomorrow. That is how our thinking has been trained hitherto. When we run into burnout, our minds are used to instant fixes. And that is why I said, I want this to come out to say, there is no magic pill in this. We have to, and again, the politics and events that have surrounded us for the last 1 month, I've almost stopped us from saying this, because I've been saying, please take time to breathe. I know breathe has become a word now that we use. Please breathe. Take the time to take a breath. You need to take time and slow down. Having done that, this is a burnout. The way to come out, it's an ongoing process that we have to find time to recharge and distress. That is a way that we can get out of that burnout. And so, having said that, what do we need to do whenever we're in this situation? There are 3 things that you need to pay attention to. And I've simplified this to the ABCs of what you want to pay attention to. Number 1, the A stands for affective or emotions. And the question that I ask is my emotional tone, is my emotional place where I am right now normal for me? Or are my feelings telling me that something needs to be taken care of? Number 2, B, is my behavior my normal expected behavior? And sometimes our feelings and our behaviors may not be read by us because of our state of mind and the challenges we are facing. And in those instances, we want to be able to look to add somebody else who can tell us, you know, this is how you're coming across. This is how you're expressing your feelings. And number 3 is my cognition. That's C, is cognition, my cognitive. Is my thinking pattern the normal thing that I've been using? Or am I getting into a thinking pattern that will spiral into the wrong place and take me to a place where I cannot handle? So these ABCs are things to carry around with you. In other words, these have become a standard, if you will, that you check yourself against to say, what am I feeling? How am I behaving? What am I thinking? When you have this, you slow down and make sure that you get some help at that point. We've talked about many before. I don't think we have time for that, but for, I think Kisha from Tanzania, one of the things that I think one of the professors mentioned here, that should have been Professor Tate or Kaigi, if I'm not wrong, Katie, but very true. It is a place not to be judgmental about yourself. We practice a very powerful strategy in my field called mindfulness. And mindfulness says, I need to be mindful and be reminded and be persuaded of where I am, not where I was or where I should have been. Being in the now becomes a powerful tool. There is no excuse that anyone can give being in the now. There is an excuse, though, you can give when your mind stays in the past, when things were different, or when your mind hopes for things different in the future, and therefore you expend your energy worrying about what will be or what might be, or wishing things never change from what they were. We cannot expend our energy, but in the now. And that is when mindfulness becomes important. So going back to Kisha, on where you are, we go back to the question we asked before. In this situation where I am right now, being mindful, what is my responsibility? How do I take care of myself and practice what has been given? but be kind to yourself. Do not be judgmental. Thank you.
Thank you very much, Dr. Sambore. And I do agree with Professor Kaiga, what she said, adding to what the nursing student needed. So that is even great. And I know one of the students mentioned about, also that was Sophia, a message that Keisha read, that seeing other people, healthcare workers are dying in front of you, it is hard. So I am gonna ask Dr. Shrim Patel, if on the unit that you are working, have you experienced a similar situation, like seeing other healthcare providers pass on right in front of you, and what did you do to help you in that situation? Because I'm trying to find things that to help also Sophia in her concern that she mentioned about seeing people, seeing videos of the nurses or doctors that are crying out that things are not going very well. It does scary. I mean, it does look scary for somebody who is looking into the profession.
So I think we faced a pandemic with a disease we have never heard of. I think we had a simple small column about coronavirus when we studied medicine a couple of years ago, but we never paid attention. So it wasn't that important. So when we were hit hard with coronavirus, we have been going through the situations actually when the videos went viral about patients dying, the nurses crying, and I personally think, as far as being a doctor and a healthcare professional and nurses, I think nurses are in far more contact with a patient compared to a doctor, because we actually treated the physical condition and the numbers of the patients. But I think what nurses did is way more than what we as a doctor did, because our job was to check the patient's condition and to prescribe and make sure that they're on the right medications, they're getting right treatment. But as a nursing, they were actually feeding the patient, they were actually taking care of the patient. So it wasn't only physically they were treating the patient, but they were also emotionally being helpful and supportive towards the patient. It takes a toll when you actually get emotionally involved with a patient, because I remember we had problems because our nurses were crying compared to when they had bed crisis where they didn't have enough protection, we didn't have enough PPEs to go on with, but everybody worked in all those stressful and situations. We all just supported each other. Like if they want, we were just there to hear somebody out. And I think it's more important if you have somebody to hear you out. It gives you a relief from all what emotional burden you're carrying inside you, because I don't think anyone has ever been to a shift and said, oh, my day was really good, because we were going through that situation where we were seeing people dying. The only good things we were seeing is like when people were going home. So it gives you a moral boost, like a 92-year-old granny, a nanny, is going home recovered from COVID, which is like a really boost to us. I mean, we have been in the situations where we had conflict with bed managers, the in-charge nurses, and the nursing students, because sometimes as a person we make mistakes and things happen. Nobody knew what we were doing, what we were supposed to be doing. The guidelines were changing every single day. We would come to the work, we were told different things by infection control. Okay, you're supposed to be doing this today, and the next day it changes everything. So in that situation, the most important thing for us is just to be working as a team and not as treating somebody according to their profession, like, okay, you are my superior and you're not my inferior. No, you just have to work together as a team and then hear them out, what they have to say. That's all.
No, thank you very much, Dr. Patel, for the insight. Yes, I do agree. It is a challenging time, and as I said, we are all learning as we continue, and especially people who are working there, they're all learning as the things are changing in front of them. So it is challenging for everybody. I know there's another nursing student who wanted to share the concern experience challenge. Oh, they have a question. Ms. Axel? Axel, are you there?
morning.
Hi.
Hi. Basically, my parent is a nurse, and she works in CVICU, and she also works with COVID patients. And one of my greatest concerns was like losing her, or like her coming home, and then like we're all infected with COVID too. But I realized, you know, going on in the semester that like we have great professors that are teaching us that like we have everything that we need, and we know we have all the knowledge that we have to reassure ourselves that we can get through this, and we can definitely, you know, solve our problems. And like if we think about it, you know, day by day, little by little, we can overcome these challenges. So that's all I have to share, really.
No, thank you. No, thank you. I mean, it does bring it to a different perspective. As a child of a parent who is a healthcare worker, that is the fear itself for that person to go leave a house and go to the where all these things are happening, and then you becoming, I mean, looking from the standpoint of the student into that profession, seeing your parent is going to work on that environment. So, I mean, that is a great perspective to share, because we can all learn from it. Yes, there's some people who have anxiety that their significant other, their child, their daughter, their son, who is leaving the house to go to those environments. Yeah, the parents also going to be scared until you come back home, and the fear of bringing it back home. So I am going to bring it to somebody else who has worked with a COVID patient and going back home and thinking of the families, thinking of being infected and worried about the health of the family. Ms. Kisa?
Hello?
Yeah, you just, Ms. Axel, that's a nursing student who her parents, one of the parents is a healthcare worker who needed to go to the hospital and work on those units. So imagine that perspective of a child worried about the parents. So then you as a parent going back home and worried about the children. So can you give us just a perspective, so at least Ms. Axel will understand on her parents' point of view, being like you, going to work and come back home, and what were you thinking or feeling as you go to work?
Okay, thank you for the opportunity again. As you mentioned, I work in the ICU, and then most of the patients, we have all of them, they were COVID patients. So my main fear was to come home and possibly I may infect the family, because you know COVID, you may not have the symptoms, but you may be infected. So that was a challenge. It's scary. It's really scary because you don't want to give to the family. So the preparation is, I mean, you have to have some way to prepare yourself, how to go home and not to infect. So clothing, how do you do with the clothing? Do you come with the same clothes which we use to the patient? Absolutely not. So we did have paper scrubs. That's what we used to wear when we have the patients, and then you change your clothes when you come home, take a shower. You do have to wear a mask most of the time because you don't know. So it was a challenge because you know you want to hug the kids, you don't want to kiss, you want to hug, you want to touch them, but you cannot do it. So is anxiety also is kind of depression because you really want to do it, but you cannot do it. Unfortunately, Sandube is here. That's my daughter. Maybe she can tell how did she feel, but it was really not good thing. Thank you.
Yeah, I wanted to start with you before I bring her back on. So Ms. Sandube, so you can hear Ms. Axel, the nursing student who just spoke with you. And then now being a child of a person who is a healthcare, her perception of her parents going and back and forth with working in this COVID area. So what is your perspective when you see your mom going to work and come back?
Yeah, so actually I can totally relate to what you were pretty much saying. I remember my mom mentioning like COVID was happening and that they were converting units, but it was one thing when you're in a different area in the state that it's happening. So by the time spring break happened, I was home, and then I actually see it in full force. Like she has a whole preparation of how the house is set up with the cleaning. My house smells like Clorox when I was home. So it was definitely an adjustment overall. And like she said, it's an adjustment overall, like just spending time with each other, because we, a family of 5, you know, my mom coming back from the ICU, we all had to do the 6 feet just in case, you know, like maybe one brother accidentally touched something and spread it to somebody else. So I think overall it definitely is hard to deal with that adjustment, especially knowing that she's in New York City and realizing as time was going on that it was going to be such a hot spot as it was. But it definitely, I think out of all the adjustments with school, I think that was the biggest one, because you want to come home and just go and do what you want to do. Then now you can't go out. Now you can't hang out with your mom. So it was definitely an adjustment, and it has some worries. And then on top of that, I know my mom didn't share, like she was definitely having anxiety about the fact that I had to come back to Buffalo to go on rotations to hospital, just because everything had changed so fast with how rotations were going to be done. So I can tell you I have a lot of PPE up here prepared, and I make sure I do what my mom told me, but it definitely was a very big adjustment for us all, especially just in the family unit wise.
No, thank you very much. And I'm sure Axel can relate, and knowing that you're not alone. So there's a lot of things going on, and being a student of healthcare and have one of your parents or both parents in the healthcare, it is nerve-wracking. So it's a lot of stress just knowing your parents is going out, and then you getting into that profession, and then start seeing all those things are happening on the workplace. So it's a lot of things, and thank you both for sharing your perspective. I'm going to invite back Dr. Sambore. You had those, the children of the healthcare. So if there's anything that they can have at least a peace of mind, or things that they can prepare mentally when their parents are letting them know, or sharing their anxiety from work, what are the things as the children of a healthcare worker needs to know?
Well, thank you. And that is a very tough place to be, especially when you have health worker and then their children are also going into nursing, or in this case, we also have somebody in the pharmacy field. One thing that in the process of all this that we've gone back to remind ourselves, and perhaps we can as well here, is that we work in systems. So, and whenever you work in systems, the members of a system actually are affected the same way, even if they are not working at the same place. This is why usually whenever somebody is sick, and you all understand this coming from the health field, the caretaker is also sick in a way, because they are moving with the same energy levels with the person who is sick. So when you have a parent or even a family member that goes to hospital every day and comes back, you actually have a different level of anxiety than the normal person, a regular person who doesn't share that. So number one, for the families that are in such situations, I keep going back, and I'll go back again because that is the area that I specialize in. I keep going back in what can we do with our mental health. We need to have practices in place that help our minds to actually feel relaxed and assured that we're doing enough to help ourselves. One of the big things that can be done or should be done, perhaps, is make sure that your schedule includes very clear transition periods. What is done when you are transitioning back home after you come from the hospital, and that is true for even those who are doing rotations in the different hospitals. When you have transition practices that you put in place, then it helps everybody in the family and helps your mind to relax a bit, because you know you have done what you need to do, and it becomes almost a checklist. And that helps us to hold ourselves accountable in the process, because you cannot just forget and walk into the house. There is a transition protocol that we need to put in place as health workers coming to join with the family. And that should help us. If it means we are going to convert some part of the garage to be a place where whenever we get there, somebody takes a shower and clothes, new clothes are put on, then that will be what we do. But then when that is done consistently, then you have other people that will in the family who will keep you accountable and remind you what you can do. That is number one in terms of physical care. It is crucial that we have transition protocols. What do we do? And even for the person who's going to the hospital and coming back home, I suggest that you have a way of transitioning your mind coming from the hospital. Imagine if you're dealing with the hospital of COVID patients where or patients who are suffering from COVID, not COVID patients. I think we need to put the patients before the pandemic. Then what we're dealing with at that point is you want to make sure you have a way where you can transition your mind. So are you somebody who likes to listen to uplifting music on the way home? Are there things that help you when you do as you're coming home? Help your mind know that I'm changing from one context to another context. Number two would be the importance of now taking care of yourself. You are a family, yes, but you have to realize the individual needs and that you need to do, and the basic taking care of yourself, become individual. Make sure that you are taking care of yourself. This will tie into the question that came from Tanzania earlier, that whenever we watch people and participate in the dying process of people, because we will be there when they're dying, there's a lot of bent up emotions that are actually held in our systems. And we need to find time to be able to expend this energy. And the best way to do that is to be able to find a way to do a physical activity. Let's walk. Let's go. If we have to go run, if we have a gym in the house, if we have something we can do, but we have to expend the physical energy to release it from being bent up in our systems and causing more havoc for us. So that's what I would say. And you have to rally together as a unit to realize that we are in this together, and take responsibility of checking on each other and reminding each other on, this is not the time to say, I know it. When your daughter, your son, or your friend says, have you done this? Say, thank you, yes, I've done it, and thanks for reminding me. Please, I appreciate you checking on me. We have to be each other's keeper at this time.
Anyway, so.
Hello, Harriet. Sorry.
Yeah, so thank you. Welcome from South Africa. I know, I'm not sure if you heard in the beginning, we had Dr. Patel from UK, who has been working in the unit where we had patients with COVID, and I know you are in South Africa training. Have you any message from our new future healthcare workers who are planning to work in healthcare environment with all these COVID-19 pandemic and stress and concern? Do you have any message for them?
Thank you for welcoming me in. Unfortunately, I joined in a little bit late, but I'll say what I feel as a healthcare professional. The thing about being in a medical field, it's more of a calling. We feel good when we help people. And yes, COVID has been a new disease, I would say, has changed perspective in a lot of ways on the way we behave. We didn't know much and we're still learning about COVID. And that should be an encouragement. I don't know, somehow that's the thing with medicine. We always want to solve the mystery. And once we find the answer or the cure, then that is rewarding. And that's the thing in healthcare profession. So I would encourage them. Yes, things can get tough, and this is one of those moments. Just try to imagine a medic who is going in a war, you know, when people go to fight in a war, you need to have medical personnel on board so that when people are wounded, they'll get care. And so is COVID. It is a disease, it's a new disease, it's scary, but people do need help and people need to be cared for. And this is the calling for healthcare providers. It does change our perspective. Sometimes maybe we're forgetting on the whole element of infection prevention control measures. We are all instituting it in some of the cases, and we are forgetting generally every patient is infectious, and we should put our feet down and handle it right. And I think maybe that is where we are going right now. If we are talking about COVID in early January, Feb, and March, when the stats were really scary, I'm sure everybody probably had a goosebumps when going to face a patient. But now we know the disease far much better than before. And yeah, we are ready to help. We are ready to assist, and we are ready to fight the battle. And it will feel much better to have more people on board, and that should be an encouragement for them to join the force. Yeah.
Oh, thank you very much. Quick question before I let you relax. So since you're working with the like new residents or people who are coming in to orient on the unit you work at, what are the things that you've used to help them feel comfortable, help them feel competent in that area? Because remember, they're coming with anxiousness and they're coming with worried about this pandemic, and still they have to do certain things that they have to do in the unit. So what are the things that you have helped new people in the unit that you work at right now?
For the medical students and nursing students have recently joined, and one of the things that they are being taught is the infection prevention control measures, and we orient them, and also how to be calm. I mean, like for some of us who have been in the system for so long, if you are doing it, what is expected to do, and you are showing them, we are helping them, and we are teaching them, and we are not scaring them, you know, like things got to move, but some of the perspective have changed. For example, maybe now they don't come in numbers. We've tried to split them in smaller groups. They don't spend more time than what they used to do, but we are orienting them. We're emphasizing on the infection control measures. Assume everybody is infectious, and once you're dealing with a person who is likely to be COVID positive, chances are they won't go there. But if you're confronted in such a situation, what is it that is expected of them? And another thing, the other mode of teaching that have evolved thanks to technology. For example, I'm now in South Africa, and we can communicate now comfortably with you in US and other colleagues in UK. So we are also employing other methods of helping the young colleagues into the field. So that is basically what has been happening as far as South Africa is concerned in terms of training.
Okay, thank you very much. And that does help with the new people who are students to healthcare, because that's one of the things I believe Ms. Catherine mentioned before, that you are learning now. Some of the clinical fields are either cut down or turned into virtual. So they might have that anxiety of not being well prepared because you were used to touch the patient. So knowing that there is a specific things that, as you say, Dr. Mkonyi, there's training specific things that they still need to do, and even if they come in smaller numbers, so that in fact give you more opportunity of spending time with a new person to learn those skills. So there is a hope for all the new students that even if with this pandemic, still the experienced people who are ahead of you are not going to let you just come in and get in trouble. They're going to probably walk through with you and slowly and give you the orientation you need, and you'll be able to be safe and take care of the patient and fulfill your dream of becoming a healthcare worker. So, so I'm going to play the video. A nurse from Norway, Oslo. Her name is Miss Anne. Thank you.
Is Anna. I'm studying to become a nurse at Nord University in Norway. I started a year ago, and I will finish my studies in 2 years' time. I think COVID-19 pandemic has changed all of us, but not for me in terms of becoming a nurse. As a student, the COVID-19 pandemic has affected me in terms of my studies. The university was locked down for the rest of this semester, which means that none of the students were able to attend any physical lectures. However, the studies continued as an online program, different but doable. But the pandemic has not scared me at all, but made me more determined to finish my studies and to continue to do the necessary and important work as a healthcare worker.
Okay, thank you. So that's the message from Miss Anna, and I thank her for just recording the message and send and share with us what her ambitions and why did she choose nursing, and she's not changing her mind. So which is great, and that just tells us that people are dedicated. So just joining the healthcare profession is not. I mean, people wants to do good, and with all this pandemic, so helping each other to learn how to take care of it or adapt to this situation, it does help to be safe and do what we want to do for our patients. So I am going to ask us again, Dr. Sambore, and if there's anything that you need to add from what the Miss Annie, who just mentioned things for school, and from the previous Dr. Martha Mkonyi, what she said from training in South Africa.
Well, thank you. I think I'm really inspired that we have a resolve to still be in the field and of changing even the way we train our professionals to be. I think that is really important. And I wanted to add this to all of us here, that in every crisis, regardless of be it the pandemic we're dealing with right now or any other crisis that it may, there's always an opportunity in every crisis. And the idea is to find what is the opportunity here. From Dr. Mkonyi in South Africa, I think I liked what I heard in terms of when she said, right now, they are taking care of or thinking about prevention more than anything before. So here in this pandemic comes an opportunity maybe to change the way we do things. So there is always a crisis, there's always an opportunity in every crisis. But going back to generally to what I've heard from the student from Norway, and I really liked what she said. Right now, as a nursing student or a medical student or in the field, it's common and you have every right to feel frightened, anxious, and even exhausted sometimes. But then for the nursing students who are coming in, I think I heard someone make this, allude to this at some point. But I wanted to say, in no way are you less of a nurse because you're going through nursing right now during this COVID pandemic. And you have to treat yourself kindly. But maybe more importantly, situations do not make us who we are. Situations reveal who we are. And for the nursing students who are here, when the situation has come our way, you will be the most sought after nurse in the field post-COVID. Why? If I was hiring a nurse post-COVID and you were to go through this and make the adjustments, I would be persuaded that the situation of COVID revealed who you are. And I want that person that you are to be my nurse, because I know when changes come our way, I know when challenges come our way, you actually can handle it because you have the skill to rise to the occasion. Why? I will have been proven right because the situation revealed who you are. It does not make you who you are.
Thank you very much. That is great. I appreciate that, definitely. And now I see Dr. Mlawa is raising his hands. Dr. Mlawa? Hi, Dr. Mlawa.
Hello.
Hey. Oh, you're still working. Thank you for coming and giving us at least few minutes. So we have had the doctors, nursing students, pharmacy students, clinical officers, nurses from all over the globe sharing their experiences, concern, anxiety, and best practice. And so we have Dr. Sambore here has been guiding us through all this discussion, and I appreciate you that part. So I know you've worked so hard at your hospital with the new either interns or residents or medical students or nurses in your unit. So if you can share anything that will encourage the new student to healthcare profession and continue doing their dream, because everybody wants to be in a healthcare profession. So if you have any advice, we appreciate any.
I think, thank you very much for inviting me. I think we've got a team from Queen's Hospital. That was Dr. Shirin Patel.
Yeah.
Who spoke before me. Then we have got, I think, my colleagues, Ria and Jamie, but we are working today, so we've been very busy. In terms of sharing what has been happening for the past 3 months, is that I think as healthcare professionals, it is our obligation to look after patients, and we take this as a privilege to look after others. And when the pandemic came, I think we learned a lot through working as a team, and I think we've come better as individuals, as human beings, post-COVID. I know COVID is still ongoing, but the past 3 months has been a steep learning curve in terms of working together as a team, regardless whether you are a nursing student, you are a healthcare assistant, you are a porter, a cleaner, or a doctor, or a nurse. So if there is something we've learned from this pandemic, if you ask me about 3 things which I can mention that we learned from this pandemic, the first thing will be a teamwork. The second thing is a teamwork. And the third aspect is, again, teamwork. So it's about working together as a team to get the best care for the patient, the best outcome. So
it has been a theme for all the discussion that we have today. Working in a stressful environment or this pandemic, we do need everyone. We do need each other, and sharing our best practice is one of them. Working and help each other come through this hard time is another. And I know Ms. Sandube Mwakalinga did say that calling each other, calling your colleague, and like you just keep a tab on each other to just say, hey, are you okay? Are you okay? Because it is hard. I mean, some people cannot travel to go back home with their family, so they have to stay at work or at the hospital. I think Dr. Shirin Patel just said that when you're on the heel of the pandemic, people were so isolating themselves, so they stay in one place or at the hospital, so you become the second family for them. So working together, supporting each other, regardless of your title, that is the goal of a good healthcare environment to work at. And Dr. Mlawa just mentioned, like, regardless, you are an administrative person, you are environmental service, you're a nurse, you're a doctor, you are a pharmacy, you respiratory. I mean, wherever you are, working together is the priority, and then we can adjust and continue providing the best care for our patients. So that is the great advice, Dr. Mlawa. Thank you very much.
Yeah, I was going to add to that. I think that there's also a question from a Techno F2 as well. Yeah, he put it in the group chat, and it's he'd like to ask: is coronavirus an airborne or only droplets transmitted? So that's,
since Dr. Mlawa is here, I'm going to let him answer that question quick.
I think we have seen throughout the pandemic, in terms of the question whether it's airborne or not, is the COVID or coronavirus becomes more dangerous if you are in an environment of aerosol generating procedures. So anyone on ventilator or non-invasive ventilation, that's an aerosol producing procedure, and therefore, if you are near those environments, you need to make sure that you wear proper protection, because you're at risk of getting that through being like airborne. But we know it's droplets, but in any environment where there's aerosol producing procedure or generating procedure is high risk environment. Areas like intensive care unit and in our respiratory ward where patients need to be on either BiPAP or CPAP, one has to be very careful.
Thank you, Dr. Mlawa. I think Dr. Shirin Patel raised her hand. Did you want to answer something? Dr. Patel?
Yeah, I'm here.
Okay.
I just want to say something on the question that was doing to persuade a new young generation to work in the healthcare profession and for them to learn to work as a healthcare professional. I think since the modern world medicine, this is the first pandemic we ever had after the plague that has been wild and world spread. And I think we are more prepared than ever before. So in a way, we can help our younger generations, our juniors, and whoever colleagues that are going to be working and will join healthcare as their profession. So I don't think there is anything to worry about or to think through. And in the end, I think everyone should be thinking about what is your goal and what is that actually satisfies you mentally, spiritually, and emotionally, so that when you come back from your work, you are satisfied. And working as a healthcare professional, in a day-to-day life, you touch so many lives. You touch them emotionally, physically, and spiritually, that gives you a different sense of fulfilling that, okay, today I have done something and I have helped a soul in going through something, either by treatment or either by anything that you've done in your day-to-day life, being as a healthcare professional. That's all I wanted to say.
Okay, thank you very much, Dr. Shrim Patel, for that advice. Ms. Keisha, do you have anything to say for our new future healthcare workers?
Yes, welcome to a wonderful profession.
It is a wonderful profession, yes.
It is a wonderful profession. What I want to say to you is it's okay to be scared. You will be scared. I'm not going to lie. Probably it's going to take you a year or two to be comfortable, but that's okay. That's normal. Everybody has gone through that. Once you start working, someday you're going to be like your preceptor. You know, as you see them and think them, they're very smart, and you keep telling yourself, am I going to be like them someday? You will be like them someday, and you will be training somebody else as well. So just be patient, continue to study hard, and stop learning. You always will be learning. That's all I have to say to you.
Oh, great.
You do
Thank
great.
you. Great advice. Professor Kaiga, are you still there?
Oh, yes, I'm here.
Okay, your question is, imagine when you are studying, coming from training nursing students, and now you are beginning nurse, and then until now. So what are the things that you can tell the new nurses or any student of healthcare, either pharmacy or medical students or something like that, clinical officers? What are the things that they need to see that there's hope at the end of all these things?
Wow, that's a hard one. I love what you just said, because it is a fabulous profession, and you never stop learning. You never, and keep your mind open. I think part of it is, I think students today, my daughter, you know, a few years ago, was always looking for that dream job, my dream job. It's going to change throughout your career, and be open to change, be open to trying working in different areas, because you never know what's gonna you know, be best for you at that time. And it's okay to work in a lot of different areas, because you bring all of your knowledge with you whenever you go into different areas. And it's a matter of taking care of yourself along the way, because as we heard about burnout, we can get burned out. So use that knowledge and, you know, really work in other areas, and open your mind to that. So it's using your education, it's using all of that, and you'll find you'll have a fabulous career with it.
Thank you very much, Professor Kaiga. Ms. Bupe from Australia.
Hi, everyone.
Hi.
Yeah. Thank you so much. And I would like to welcome our students in board, that this is a professional I love in my life ever. I've been touching everywhere, maybe trying to be somebody or maybe to be a secretary, but I never enjoy at all. Because what I feel that is from my bottom of my heart is to help people who are in need. because I'm there for patients. I'm there because I feel like I can do something to change their lives. So whenever I see patients being discharged and saying, goodbye, nurse, I'll see you sometimes, I feel very comfortable and I feel very impressed that I've done something, I've changed people's lives. So what I would like to just to encourage you students that this career you should learn, because there's some nurses who are already, those who are retired. Surprising what I find that they came around, raised up their hand, came and joined the battle. So we worked together. However, these people were out of nursing, but they thought, no, still we are nurses. So you be the nurse from now forever. You never change it. And also be flexible and trust on yourself. Believe on yourself. Do I really need to be a nurse? Because being a nurse doesn't mean that you are a person who is vulnerable to any infectious. No, because we are there. We know exactly, like this coronavirus. What I've learned, I found that this was a war for the importance of sanitation, hygiene, including hand washing. Because sometimes we do really forget about those things, are small things, but we have seen the outcomes. So now everywhere, first of all, we have put ourselves in front line. You can see people clapping for us. They never do that. So please take this role with your heart, with confidence, move, do the best, learn a lot of things to people who are ready to teach you, and don't scared, don't get disappointed. So that's only my word, and I wish you the best.
Thank you very much, Ms. Bupe from Australia, all the way out to Australia. So thank you for joining us and giving us your experience and inspire the new healthcare workers.
I definitely enjoyed all the panelists that have spoken today. I like the fact that, you know, everybody has been open about what is really going on with them, you know, work-wise, school-wise, and home-wise. As a nurse, I've been a nurse for over 15 years, and I have seen a lot. And obviously, I never thought in my wildest dreams that I would be a nurse, you know, during COVID-19 era. And so I too did, you know, experience a lot of fear. I started asking myself questions, you know, what is the right thing to do by my patients now? Do I stay at home and do I stay home, or do I take care of these patients? And although I'm not doing direct care right now, I still get to review a lot of hospital clinicals and make decisions, including, you know, do a lot of discharge planning for patients that have COVID-19 and their families. And so I do want to encourage you, you know, moving on, this is definitely not going to be the beginning. You know, something else will probably come up. Dr. Bore, if I can use your words, the reason behind why I do what I do today is really the satisfaction that I get out of caring for patients. And so that to me has been a driving force, and let it be your driving force, you know, moving on, including, you know, finishing your school and going about, you know, the reality of nursing in your profession. So you have not made a wrong decision to get into this profession. The rewards are just humongous. I mean, they're impactful. You can see the rewards, and it doesn't matter what area of nursing you choose to do, you know, for the rest of your life. The rewards can be seen and they can be measured.
Very much, Ms. Buren. Yeah, that was great, and we definitely needed to hear that. So thank you. So So to summarize, I mean, we have learned quite a bit from all over the globe, and I appreciate all your times and your contribution and your experiences. And I've learned a few things today, so I appreciate all the advice, suggestions, and learn from other people's experience. I do appreciate your time again. One more thing, just to encourage you, we are, the goal of the organization, Dr. Gabone QHSC, is to encourage and train and educate healthcare workers. We are usually do the nursing training and the doctor's training, and of course all the pharmacists and other areas. So if you are interested in joining us, and so we can accomplish our mission, we do our mission here in United States and in Tanzania, and we're still going everywhere. So if people from UK are interested to come and join us, that would be great. And then when COVID is managed or run away from us, then you'll be able to actually do our medical missions and going around. And I appreciate all your support and giving us your time to come and share your experiences. And I will also encourage you to continue doing that. So when we are doing all this presentation or training or specific education, I will ask you again for individual contribution and participation. So I will appreciate when if you come back again to help us and enrich us with your knowledge. And so if somebody is again interested, the same email you use to register, that's the same email you can send the concern questions or ideas. And if you want to participate, just send that email. We will get in touch with you and help us continue reaching those vulnerable population. We are all volunteers, and we join this healthcare profession because we want to serve the other vulnerable population. So if you're willing to join us, I welcome every single one of you to come and join us. And so we have been doing these conferences for a while now, and this is our 6th, and we're going to start probably space them a little bit, and then so the more the future conferences are going to require probably more clinical application and more practice services and training. So we are going to probably do a little bit different, but you get more information. Again, I want to thank you, every single one of you who participate here. Before you leave, please, if everybody is able to do the to bring a video up, so we can have every single person on the screen.
Put their images up and do the gallery view. Yeah. And then also, I think it would be good to recognize the students that are still here. I know some of them have left, but that's awesome that the students are jumping in and getting involved.
Yes, I mean, no, thank you for all the students. I mean, it was great to learn from you. And, you know, even as a professor, I still learn from my students because sometimes they may ask something that I did not think about it, or I thought is just regular information. But then if they ask you, you have to reflect and you learn from that experience. So I think Ms. Kisha Mtabiri was saying continue learning, and Professor Kaiga also said continue learning. So don't stop learning. Even if you start working there 10, 15, 20 years, continue learning every single day. And I appreciate Dr. Sambore, and he said, remember those ABC? We're gonna ask a quiz at the end of this conference. You have to remember to name those 3 things. But I do appreciate all the learning. Dr. Shrima Patel, I think because some of them have to go back to work, but yeah, so Ms. Bupe, thank you. Mr. Gilbert Gabone, thank you for being here.
Look at this Bupe.
Yeah, I know. That's okay. Edmund, thank you very much for coming. Ms. Kisa, thank you. Ms. Sam Mongota, we didn't hear you though today. But thank you for coming and joining us. As I said, if there's anything.
Bupe.
Mr. Brina, you didn't say anything.
Hello.
You can share your experience quickly, 1 minute, please. You're just a brand new graduate and has been working and in the middle of the pandemic.
Yes, indeed. So for me, I'm going to just share quickly. So some of the things that I do to stay afloat, I do the self-talk, I pray, I meditate, I read books. Now that I've gotten over the trauma of what's nursing school, I read for leisure now. I've been a nurse for 3 months in a telemetry unit. I started right in the midst of the COVID, so it was a bit scary. But my hospital, we test the patients before they come to the unit. So my floor technically does not have any COVID patients. There has been some instances where a patient has tested positive after. So that gets a little bit scary. Our PPE is a bit limited. They have this whole conservation where you come in, you get one mask for the week. Unless it gets broken or dirty, then you get another one. So that's something that, and also we're short-staffed because a lot of our nurses get floated to the COVID units. So on any given night, I have 7 patients. So that's a little bit challenging. But just to keep it short, some things that I would share with the new nurses would be to just breathe, because we're learning, they're learning to do this stuff. And by the time they get there, although it doesn't feel like it, they have what it takes to do it. Time management is essential. It's important to adapt to change. And also, I would recommend a nurse residency program. That's what I started as, and it was very helpful. So thank you for the time.
No, thank you very much for sharing your experience. I know, yeah, you started right there where the COVID is like up here. So I can imagine, as you said, you're studying your profession. This is what you want to do for the rest of your life. And all these pandemic issues and concern comes from there. So, but I mean, I think Dr. Sambore and somebody else, Dr. Patel, did mention that you guys are the one who have been trained the most, because if you can survive and pass through this, that means you have that resilience that we are looking for the nursing profession and healthcare profession. So you have that, you can survive it, you can pass through it. So anything else is going to be as easier compared to people who have never been through the pandemic. So, I mean, we give you credit for sticking it up there. And yes, that is great. Thank you for sharing that insight. So if you guys have anything else to say, I am gonna close the meetings, and I thank you very much. And everybody's gonna get the recording of this part, and then if you can share with people so at least everybody who can learn. I know some people had issues with the technology. They couldn't log in, but we can share, and so we learn from it, and hopefully we help continue supporting our new healthcare workers. Thank you for giving me this time on your Saturday. So until next time.
We're going to try to high five. High five.
High five, everybody. Thank you.
Thank you,
Bye.
everybody.
Thank you. Bye.
Bye.
Viola's coming.
Okay, guys. Bye, everybody.